urgent care would not be possible without the vision and the leadership of our board. And joining us today representing our board is Mr. Tom Kananowicz from our Health Network board. Tom, thank you for your partnership and your leadership. So today we offer a real solution to a significant problem facing the healthcare system today. You know, it was probably a couple of years ago when some statistics really grabbed us at Hackensack Meridian Health, and we said, you know, we got to do something different. We got to take a leadership role. We looked at statistics that showed that 1 out of every 5 Americans have some sort of mental illness. We saw the rates of depression across the United States and in New Jersey significantly rise. We saw suicide rates continually going up. Just last year alone in New Jersey, over 3,000 of our citizens passed away due to opioid overdoses. So we wanted to do something, but in behavioral health, we wanted to make sure we could take a leadership role and really change that trajectory. But we knew we couldn't do it alone. So we sought out a partner, and we did a national search for a partner, which brought us right back here to New Jersey and the Carrier Clinic. Not only are they the largest provider of behavioral health care services in the state of New Jersey, but they are so well respected amongst the community that they serve, but amongst our clinicians as well, who had many, many years of experience with the Carrier Clinic. And I'm happy to say that we were able to merge with the Carrier Clinic earlier this year. We have 3 major goals. One is very, very simple. It's to remove the stigma once and for all that exists with behavioral health, with people who have mental illnesses and addiction. We are rapidly doing that by coordinating care, by making care less fragmented, by integrating behavioral health in everything we do at Hackensack Meridian Health. The second goal was to really capitalize on the Carrier Clinic's technology in order to really be innovative and really provide people with behavioral health issues the latest treatments through new technologies. And the Carrier Clinic has been doing it for years, and now Hackensack Meridian Health will be able to provide those innovative treatments through technology as well. And then the third goal, which is why we're here today, is to rapidly expand access to care. I talked about the Addiction Treatment Center a few minutes ago. That's going to be a significant project for the state of New Jersey. It's going to include 80 inpatient beds. It's going to have a whole host of comprehensive outpatient services and programs. As I mentioned, it's going to be online at the end of this year, beginning of next year. You know, too many people in New Jersey, particularly our young people, are still traveling out of state for addiction treatment services. They're going to states like Florida and Arizona and California. And you know what? Some of the reports that we get back aren't so good from some of these other states. We need to have a world-class addiction treatment center right here in New Jersey, and our dream is going to become a reality as of next year. So again, we thank the Gallus family for their efforts, and certainly our partnership with Carrier Clinic has enabled us to do that. The second major initiative to really expand access to care is right behind me, and that is the first Behavioral Health Urgent Care Center. And think about this. Patients with mental illnesses, patients with addiction, patients who have behavioral health care issues have to navigate our busy emergency departments. Our emergency departments that where they're competing with patients who have strokes, who have heart attacks, who have been in motor vehicle accidents. Many of those patients don't need emergent care, but they need urgent care. They need quality urgent care. And that's exactly what we're going to do here. They will have their own space, they'll have their own waiting area, they'll be able to see a mid-level behavioral health provider within minutes. And they will also be able, through technology, through telepsychiatry, receive a consultation from a psychiatrist if that is necessary. We think this is really going to revolutionize behavioral health in many, many ways. It will improve access to care. And I have to tell you, just since we have announced this, we have received a lot of inquiries from my colleagues, not just here in New Jersey, at other healthcare systems, but across the country. They would like to do the same thing. So I think As always, Hackensack Meridian is becoming the leader of something that's going to become very, very prevalent in months to come and in years to come. As a matter of fact, we think this is going to be very successful here in Neptune. We plan to scale this at our other urgent care centers throughout the state of New Jersey. So this is really an exciting project. I want to thank all of you for helping to support it, for your support of Hackensack